Listen up, all you veterinary professionals. We've got some exciting news that will make your tails wag. VETgirl is now offering a free 14-day trial membership that will give you access to our full on-demand library of veterinary continuing education, webinars, and other resources. It's time to unleash your inner learning beast and sign up for your free trial today. Don't let this opportunity pass you by. Join the VETgirl pack and get your learn on today.
In this VETgirl podcast, we're diving into intervertebral disc herniation, or what we'll call IVDH from now on, management in cats. You may have noticed that there's not a ton of information out there about disc herniations in our feline friends, and there haven't been many studies on how to manage them. In general, this is kind of like a Frenchie or a Dachshund thing, right? So today we'll be discussing a recent retrospective study from the Journal of Veterinary Internal Medicine entitled Outcomes of Surgically and Conservatively Managed Thoracolumbar and Lumbosacral Intervertebral Disc Herniations in Cats. Now, we know that in dogs, there's plenty of research on managing IVDH, but in cats, it's a different story. The prevalence of IVDH in cats has been reported to be between 0.05 to 0.26%, while in dogs it's upwards of 2 to 3.5%. Thoracolumbar or lumbosacral IVDH are the most commonly reported locations, and disc extrusions and disc protrusions are their most common types of disc herniations. Previous studies suggested that about 85% of cats with intervertebral disc disease could have good to excellent outcome with conservative management alone, which generally includes things like strict rest, pain meds, anti-inflammatories, physiotherapy, maybe some hydrotherapy or acupuncture, and bladder management. On the other hand, surgical outcomes have been more variable, with good to excellent results ranging anywhere from 67 to 91%. One recent review reported good to excellent outcomes in 71% of cats after surgery. These studies were defining this good to excellent prognosis as documented improvement or even full resolution of their symptoms. So the authors wanted to provide more information about feline compressive IVDH and compare outcomes between surgical and medical management. So again, this was a retrospective study evaluating the records of 92 cats referred to the neurology service at a veterinary teaching hospital or a private referral hospital between 2012 to 2022. Cats were included in the study if they were proven to have compressive intervertebral disc herniation, or IVDH, between T3 and S1 based on imaging with an MRI or CT. A neurologic examination had to have been performed by a boarded veterinary neurologist or neurology resident, and follow-up outcomes at least 4 to 6 weeks after treatment had to have been recorded for the patient. Any cats with acute non-compressive nucleus pulposus extrusions were excluded from this study. And cats that had concurrent spinal conditions like neoplasia or vertebral fractures were also excluded, so the authors did a really great job of limiting variables beyond the IVDH. Cats were categorized into 3 groups based on the type of disc herniation. These were intervertebral disc extrusion, intervertebral disc protrusion, and a third category of both types happening in the same patient. Intradural intramedullary intervertebral disc extrusions or traumatic intervertebral disc extrusions were grouped into the intervertebral disc extrusion category. If IVDH occurred in multiple locations in the same cat, this study focused only on the most compressive or what was presumed to be the most clinically affecting site. The authors gathered descriptive information such as neuroanatomical localization, pain, progression, lateralization of impairment, and any known history of trauma. Onset of clinical signs were described as hyperacute if less than 24 hours, acute if between 1 to 7 days, subacute between 7 to 15 days, and chronic if over 15 days. Modified Frankel scale scores were recorded on admission, at discharge, and on 4 to 6 week follow-up, and was an important tool in the study for being able to objectively assess the neurologic changes in these cats. So what is the Modified Frankel scale? Let's quickly review the scale. It ranges from 0 to 5 with different interpretations of the direction in severity. So do be careful when reading up on this score, because in some literature, a 0 will mean the most neurologically affected and a 5 will be normal. But in this journal article, a 0 represented being neurologically normal. A 1 represented just spinal pain with no neurologic impairment specified. A 2 meant the cat was ambulatory but paraparetic. A 3 was non-ambulatory and paraparetic. A 4 was paraplegic with nociception preserved. And a 5 was a paraplegic with absent nociception. Quick note, it remains unclear whether the person assigning the modified Frankel scale score differentiated between superficial nociception and deep nociception. Outcomes were categorized as success or failure at 6 weeks and 6 months after diagnosis. But for cats in the success category at 6 weeks that then had no further 6-month evaluation reported, it was assumed in the study that the cats remain unchanged. To make it into the success category, cats had to have urinary and fecal continence, no continued requirement for pain medications, and they had to show an improvement in neurologic status, which could have been something like a former paraplegic regaining ambulation or even a mild improvement in ataxia. Now, this is important. The study didn't differentiate between the amount of improvement from admission, just whether or not there was improvement. Among the 92 cats that met the inclusion criteria, domestic short hairs were the majority at 51%, or 47 out of 92 cats, followed by domestic long hairs at 11%, British short hairs at 8%, Persians at 4%, and other represented purebreds included Bengals, exotic short hairs, British Blue, Burmese, Siamese, Siberian Forest, Sphynx, Oriental Shorthair, and Maine Coon. All in all, the total of purebred cats with IVDH was 34%, or 31 out of 92 cats, and non-purebred cats made up the remaining 66%, which was 61 out of 92 cats, with an overall incidence of feline IVDH of 0.44%. So actually, when the authors looked at all the cat records in the hospital to tease out the incidence of IVDH, it becomes more like 0.62% incidence in purebred cats and 0.39% incidence among the mixed breed cats. Patient characteristics of the group, such as age, sex, and weight, were not broken down in the methods section for review, but these were mentioned briefly in the author's discussion. One key bit of information to tuck away before moving on to the results is that cats that received surgery presented initially with higher modified Frankel scores, meaning they were more neurologically affected, and that's important. So what did the study find? There's a lot to unpack here. Most cases originally presented as acute in 34% of cases, followed by chronic in 32% of cases, while 18% presented hyperacute, 9% subacute, and 8% as acute deterioration of chronic signs. Okay, on to the lesions. Keeping in mind that some cats had multiple lesions in their spines, authors note that 57 intervertebral disc extrusions were identified, 50 intervertebral disc protrusions were identified, and then 11 of the combined extrusion and protrusion were identified. 4 intradural intramedullary intervertebral disc extrusions were identified, and no hydrated nucleus pulposus extrusions were identified. For management of IVDH, 49 of the 92 cats underwent surgery, 36 were treated conservatively, and the remaining 7 were euthanized at diagnosis. Of those cats that were euthanized, 6 had intervertebral disc extrusions and 1 had intervertebral disc protrusion. This study found no statistical significance between the ratio of cats that were treated medically or surgically across the 3 different groups of cats, with, again, the intervertebral disc extrusion, disc protrusion, or both. Now for the outcomes. Outcomes at the time of discharge were not reported in this article for either group. Starting at the 6-week follow-up, there were only 68 of the original 92 cats represented. After factoring in the 7 cats that were euthanized at diagnosis and 3 euthanized before the 6-week mark because of complications related to their spinal disease, that leaves 14 cats unaccounted for at the 6-week follow-up. Surgical treatment, which included procedures like dorsal laminectomy or hemilaminectomy, depending on the location of the disc herniation, resulted in successful outcomes for 26 out of 42 cats. In this slightly increased to 29 out of 39 cats that were available at the 6-month recheck. Meanwhile, conservative treatment led to successful outcomes in 14 out of 26 cats at the 6 weeks, and only increased by 1 additional cat to 15 out of 23 cats at the 6 months. The authors specifically looked at cats that had traumatic causes for their disc herniation, and at 6 weeks, the majority of cats in both treatment types, 92% conservative and 86% surgical, had some degree of persistent neurologic deficits. 3 cats were euthanized before the 6-week follow-up for complications related to their spinal disease, and 3 additional cats from the surgery group were euthanized before the 6-month follow-up, with only 1 specifying that it was due to continued incontinence, and the other 2 were either not related to their spinal disease or it was unspecified in the report. These results suggest that conservative treatment of cats with IVDH is an option still likely to meet with successful outcomes, which is great news for owners who may be hesitant about surgery. And then real quick, the authors wanted to describe the outcomes of the cats that specifically had intradural intramedullary disc extrusions. All 4 of these cats had lesions localized to the lumbar vertebrae. 3 of these cats were treated medically and 1 treated surgically, all showing improvement, but 1 of the medically managed cats still had urinary incontinence, paraparesis, and pelvic limb ataxia at 6 months out. While one of the author's goals was to compare medical and surgical management outcomes, the other was to describe characteristics of feline IVDH because reports are just so lacking on this feline disease. So the mean age of cats with clinical presentations of IVDH was 9.2 years in this study, with more than half of the cats being male, reportedly 60%. And since the majority of cats were neutered at 91%, the authors note that there wasn't enough diversity to evaluate neutering as a risk factor. While the authors mention that heavier cats and younger cats in this study were found to show more neurologic improvement, these relationships warrant further investigation with follow-up controlled studies. It's worth mentioning that cats in this study with traumatic causes of IVDH appeared to have higher chances for successful outcomes. Although initial clinical signs were variable, with most cats presenting with spinal hyperesthesia and progressive neurologic impairment, the study found that cats with the intervertebral disc extrusion presented with shorter duration of their clinical signs and with higher modified Frankel scores than cats with the intervertebral disc protrusion. The intervertebral disc extrusion was typically localized along the lumbar spinal segment, and intervertebral disc protrusion was most common at the L7 to S1 disc space. As with all studies, there are some limitations. Disc herniation is relatively rare in cats, therefore there are a limited number of cases in this study. Also, since it was retrospective, it wasn't a controlled study, and follow-up wasn't always consistent. For instance, cats that showed success at 6 weeks but were lost to follow-up were presumed to still be doing well at 6 months, which may have falsely increased that 6-month success percentage. Additionally, the study didn't compare cats that were managed conservatively first and then went on to have surgery later at a specialty hospital. And the authors do note that because the more neurologically affected cats with higher modified Frankel scores underwent surgery, this does skew the data so that to better understand outcomes in cats that present with more neurologic impairment, we would need follow-up studies comparing medical versus surgical management in this specific subset of cats with the higher modified Frankel scores. So what can we take away from this VETgirl podcast? Both surgical and conservative treatment of intervertebral disc herniation in cats can have successful outcomes. The key is to manage client expectations that either option can improve the cat's movement, bodily functions, and comfort. But healing takes time. Sadly, these disc herniations won't recover overnight, but they can do well even if surgery isn't an option for the individual cat. Despite their back troubles, with the right home care, many of these cats can get back to good quality of life with or without surgery. Until next time.